Today we're privileged to focus on some of the very exciting observational studies that are being conducted by outstanding investigators that are affiliated with us. You'll be hearing from Dr. Gad Marshall, Dr. Rebecca Amariglio, Dr. Jasmeer Chhatwal, and Dr. Patrizia Vannini. You'll also be hearing from two of our research ambassadors, Sandra and Frank Esmond, who are going to tell you a little bit about their own experience as to why they decided to join us and participate in research studies. So next slide. Let me tell you a little bit about who we are and a few reminders. We're going to take a short poll, or at least are we going to be doing that today, Christine? A poll? You may or we may not. I'm not positive, but I know that you'll be getting a survey after the program is over. We're going to ask that all of you remain muted throughout the presentation. And we're also going to have opportunities for you to ask questions after each of the speakers. So you can click the chat box and you can ask your questions there. If you want to raise your hand, we're happy to call on you. So I think that's what we're going to, we want to make this interactive so that you all get a chance to participate. Next slide. So the Massachusetts Alzheimer's Disease Research Center is really a center that's funded by the NIH and the National Institute on Aging that's led by Dr. Brad Hyman. Next slide. It actually encompasses both the Brigham and Women's Hospital as well as studies being conducted at the Mass General Hospital. We have a number of different teams that are affiliated with us. And these are some of who they are. And so if any of you are interested in participating in research, we hope that you will get in touch with us and let us know what your interests are. Next slide. We conduct clinical trials, observational studies, which you're going to hear about today, and also prevention studies. And you can see that we encompass diseases across the entire spectrum, including, which is not a disease, normal aging. So if you're normal and you want to help participate in some of our research efforts, we hope that you get in touch. Next slide. And we also try very hard to reach out into the community. We have partnerships with Union Capital Boston, Memory Sunday, the Family Van. We're developing new relationships with Dr. Anderson at the Dimmock Center. And also you can see from our website videos that have been produced under the direction of the Bright Focus Foundation. So if you need more information, we're going to ask that you go to our website and explore around and look at the many interesting things that are there. Next slide. And again, like we're going to have Sandra and Frank Esmond with us, but we have many different research ambassadors that are already participating in clinical trials. And we really count on them because they're such beacons of light to those of you who still have questions about a research study, and they can share their experiences of why they participate as well. Next slide. So now it is my pleasure to introduce my dear friend, Dr. Gad Marshall. He's the medical director of the BWH Center for Alzheimer's Research and Treatment. He's an associate professor of neurology, and he's going to be speaking to you today about his study on instrumental activities of daily living. So Gad, do you want to take it away?
Thanks so much, Dr. Rentz. So let me load my slides here, one sec. All right. Oops. Okay, we can see my slides. All right, okay. So So I will be talking about the IDL study, or Instrumental Activities of Daily Living study, which actually is a couple studies, and one also focused on apathy or decreased motivation. So here are my disclosures, various funding resources, as well as my clinical trial work at Brigham, as mentioned earlier. So, why are we doing this? What is this focus? A lot of what we study in Alzheimer's disease relates to cognition, memory, thinking abilities, but we also look at daily functioning, which can be very clinically meaningful for patients and families, as these reflect changes in daily routines. As has been the case for our center, we are focused on early changes in folks. And so here I'm focused on early changes in daily functioning, which has been a challenge to measure with our traditional questionnaires. And so we developed an assessment that we think potentially is more objective, of a slice of daily functioning. In this case, trying to walk through a phone menu or an interactive voice response to perform a number of tasks. So refill a prescription like you would do at a pharmacy over the phone, call your health insurance company to actually select a new primary care physician, and then also a banking task. And arguably the last one is not used really much by phone anymore, but we wanted to stay within the same modality. And we've tested this assessment for a while now without any imaging or biomarkers, and got funding to look at it with a bunch of different scans of the brain to try to localize where in the brain these functions where they sit, as well as try to relate them to early biological changes such as amyloid and tau deposition. And so both myself and Dr. Amariglio, you'll hear from her later, received funding from the NIH, and I added my assessments to her grant to look at daily functioning in individuals who are early stages, so either actually cognitively normal older adults who may be at risk for Alzheimer's, individuals with subjective cognitive decline who are in Dr. Amariglio's project, and individuals with mild cognitive impairment preceding dementia. And so we're looking at this phone task, that's the Harvard automated phone task, as well as a few other measures of daily functioning. So the CFAB is a tablet-based assessment developed at the University of Miami, financial capacity instrument developed University of Alabama, Birmingham, and then a couple questionnaires that appear to be sensitive for daily functioning, the ADL-PI and CF5, as well as more standard cognitive testing. And we're following folks for 3 years. And as I mentioned, we obtained a variety of scans of the brain, as well as measures of A-beta and tau in the plasma, which Dr. Selko at Brigham and his team have worked on now for several years. So another direction related to daily functioning is trying to assess these as they relate to usage of smartphones in a medical setting. And so we developed an app that looks at how individuals may use a patient portal, a simulated patient portal, to do a variety of tasks. And then also some of the tasks include scheduling appointments, and so also put them on their calendar, again, in the simulated calendar as part of the app. And this is something that we received additional funding for to pilot, which we're doing at Brigham, and hopefully then bring to MGH for this study that I mentioned earlier, to add this as another measure of daily functioning. And so different direction is looking at motivation, apathy, or lack of motivation or interest in things, which is a very common symptom that we see early on in Alzheimer's disease. So there are a variety of mood and behavior symptoms that accompany cognitive symptoms, and apathy is one of the early ones that we see. And so in the past, we looked at it with FDG PET, or metabolism of sugar in the brain. And we've also looked at it with tau PET in a small cohort. And so we obtained additional funding to look at it in individuals who have specifically apathy. And we tacked on this to the prior study looking at the normal and MCI participants. And then Dr. Vannini, who you will hear from shortly, got funding to look at individuals with mild dementia. And we tacked on these assessments there to try and get to the bottom of why people become less motivated as they age, which could be quite frustrating for especially their family if they seem to be able to do things, but they are not motivated. They lost their initiative. And lastly, I'm just going to mention another novel aspect that's a sub-study that we're adding to these cohorts, retinal imaging that is performed with a camera that was developed by a company called RediSpec in Toronto. And we've partnered with them to be able to administer this test that will be looking for evidence of amyloid in the retina. So this is still experimental, of course, but trying to match what we see on the PET scans with something simpler, cheaper, and hopefully more easily available. And so that's something that we're starting as we speak. We got the machine set up actually at Brigham for our participants. And hopefully in the next month or two, we'll be scanning folks with this novel technology. And so that's the last thing I was going to mention. And of course, I want to thank all my colleagues for collaborating on these projects, the funding, and most importantly, the participants and their study partners who've been dedicated in these various studies, participating and going through a lot of assessments, and hopefully we'll have more participants. So I'll stop there and take, if we have time for questions now, I'll take questions now.
Gad, such interesting work that you're doing, and I love this retinal idea as well. Are there any questions from anybody online right now that you would like to ask Dr. Marshall? Well, there will be plenty of opportunity to do that if you can't think of one right now. So we can move on then to the next presenter, which is Dr. Rebecca Amariglio. I don't know if a slide's going to come up briefly. Yes, for her. But Dr. Amariglio is a very good friend and colleague, a clinical neuropsychologist and assistant professor of neurology, who's been working a long time on, does it matter if you complain about your memory? So Dr. Amariglio, I'm going to ask you to now present on subjective cognitive decline and the interesting study that you're doing. Go ahead.
Thank you, Dr. Rentz, for the introduction. Happy to share a little bit about what subjective cognitive decline means. These are my funding sources. I'd like to start off by first presenting to you what we think of as typical age-related complaints. So for those of you listening, some of these might seem familiar to you. Certainly happen to all of us, where there's a tip of the tongue phenomenon where you're maybe having trouble coming up with the name of somebody, particularly a movie star or someone you don't know that well, finding words, misplacing belongings. Where did I put my keys? Where did I park the car? A very common one is, what did I walk into this room for? And what was I about to do? And so again, these are fairly typical that we expect to happen as people get older. That's in contrast, though, to a serious memory problem that we would expect to see at the stage of when somebody has cognitive impairment or dementia. So, when somebody has Alzheimer's dementia, you see evidence of poor judgment and decision-making, and inability to manage a budget, losing track of the date or the season, difficulty having a conversation, misplacing things, and being unable to retrace steps to find them. But it seems that there might be a stage prior to that of dementia where people are starting to notice memory changes that are of concern to them that kind of fall in between the normal aging and to the stage of dementia. And so it's important to, I think, make sure we're all on the same page in understanding Alzheimer's disease and that it's on a continuum. And that, you know, when somebody reaches the stage of dementia, it didn't happen overnight. People before reaching the stage of dementia here can first have something called mild cognitive impairment, where they're having some memory changes, but still functioning normally in their everyday. And then mostly, and then at the preclinical Alzheimer's stage, which Dr. Marshall mentioned as being of great interest to our group, where people are performing normally on cognitive assessments and don't show impairment, but are hinting at subtle changes, cognitive changes, either and in my case, in this study, looking at the kind of memory complaints that people have, where there's a subtle change before they might go on to have impairment. So again, this doesn't mean that everyone who has a memory complaint has or will get Alzheimer's disease, but we're now realizing that for some, a subset of people, that some of these concerning memory changes might be an early sign of somebody at risk for developing cognitive impairment. And so one way in which we can look at preclinical Alzheimer's disease, again, Dr. Marshall talked about some of these biomarkers, amyloid and tau, that he's looking at in his study. But just to kind of, again, share with everyone how we're thinking about this. Using PET imaging, we can look at these biomarkers, and you'll see here that there are three people's brains presented here with PET imaging, and we can see people to the left who are normal, and then those with dementia, and we can see that they look very different. But they're here highlighted in the middle is a person who's clinically normal, but actually has evidence of amyloid and tau on their PET scan. And this is someone we consider at the preclinical stage of Alzheimer's disease, where they're performing normally on testing, but have these elevated biomarkers of amyloid and tau. And that's really who we're hoping to target in the SED study. So looking at these biomarkers with these memory changes or memory complaints. And we have seen it in our previous research. This is taking data from a large secondary prevention trial, the SCREEN data, where we can see that individual items on a questionnaire that asks people about their memory, if there's been a change in various items over the last year, a number of these items, those with the little star, are ones that we see are related to elevated amyloid. So people, again, who maybe at the preclinical stage of Alzheimer's disease are more likely to endorse these items. So some of them are noticing a substantial memory decline in the last year, seeing a doctor about their memory in the last year, but misplacing things more often in the last year. Interestingly, the one question that this is a participant and their study partner reporting on the participant are both noticing these changes, except for repeating questions, where the study partner is noticing the participant is repeating themselves more, but the participant doesn't notice it themselves. So this is looking just cross-sectional data, or at one time looking at the correlation between the amyloid and these memory complaints. But we can also look over time what happens. And this is data taken from the Harvard Aging Brain Study, where we can see that those with elevated amyloid in red compared to those with elevated or non-elevated amyloid in blue. When the participant themselves reports how they're doing over time, they're actually starting to have a lack of awareness of their performance, those with elevated amyloid, and they don't show an increase in noticing memory complaints over time. But for those who have preclinical Alzheimer's disease, their study partner is over time noticing this creeping up of memory concerns or complaints over time. So it's both very interesting to look at things cross-sectionally with memory complaints at the stage of preclinical Alzheimer's disease, as well as longitudinally. And we're seeing these interesting patterns occur over time. So we're currently recruiting for a new subjective cognitive decline cohort. So individuals who are 60 and older, they need a study partner to participate in the study. We're recruiting both from the community and from the clinic. So people who might come in to the doctor to see their doctor because they have a concern for memory, but then are found to be normal on testing. And then from the community, they have to endorse a few questions that they're noticing changes in their memory to participate. The participants are followed for 4 years. They get a baseline MRI, an amyloid and tau PET, and then MRI and tau PET 3 years later, an annual cognitive battery of neuropsychological testing, an SED assessment or questionnaire, and then also at-home assessments that occur every few months that can be sent by computer or phone that you can take very easily at home. So that's the overall study. And I have listed here the coordinator's email for anyone that might be interested in this particular study. So any questions for anyone?
All right. Thank you, Rebecca, very much, Dr. Amariglio, for this fascinating study. You know, when I was a young clinician, if you mentioned that you were worried about your memory, it often was a sign that you were worried well. And because of Dr. Amariglio's work in this area, we're beginning to realize that people do have a leg up or a head up about what is important to them, and that we as doctors are finally beginning to realize that we need to pay attention to these complaints. Any other questions for Dr. Amariglio? All right, we'll move on then to Dr. Jazmeer Chhatwal. Dr. Chatwell is now an associate professor of neurology. Congratulations, Jazz. And is doing some fascinating work with sleep, and is hoping to share that information with you now. So go ahead, Dr. Chatwell.
Thank you. And thanks to all of you for being here. I think, it goes without saying that we couldn't do any of this without people like you participating in our studies. And, I hope that by being here, you're going to learn more about really the breadth of things that are going on. There's so many different ways to try to understand how people age over time in terms of their memory, language, and attention, and also with respect to what might be more drastic changes in memory that can be concerning for a neurodegenerative disease. So I'm a neurologist and also do quite a lot of research. And what I'm going to talk to you about today is a new study that's trying to understand how changes in sleep might be related to changes in memory and the buildup of Alzheimer's disease proteins in the brain. So why care about this? Well, I don't think I have to tell the audience here, but Alzheimer's disease is a huge, huge problem in our society and around the world. Even as our colleagues in cardiology and oncology and other fields have done, fantastic work in terms of lengthening people's lives and making some conditions that weren't treatable now treatable. Unfortunately, with Alzheimer's disease and related conditions, we just see an increase in the number of people that are affected, and it's becoming a more and more common cause of death. And that's what's shown here. Unfortunately, we're in this purple bar way on the edge. One of the things that's fascinating but also frustrating about Alzheimer's disease and recognizing why people decline is that we know that Alzheimer's disease is characterized by the buildup of two types of proteins in the brain. The first one, which is on the top over here, these circular structures, is amyloid pathology. This we think happens decades before people develop any symptoms. The problem is that many people who have these amyloid plaques in the brain don't decline over time. There's a subset that do show that decline, the subset that show this pathology down below. This is tau pathology. But just looking at the amyloid, there's many people that have it that don't go on to develop the tau pathology and don't go on to develop cognitive decline. And so what my portion of the group tries to do is to understand that, to understand why there's certain people who have this amyloid buildup in the brain and decline, whereas others seem to be resilient to it and don't show those changes over time. And so we've looked at many different things. I'm talking about sleep disruption today and overall activity level. But there's other things, vascular factors, inflammation, changes in blood flow. But today I'm just going to focus on a new study that's looking at sleep. So we call this study SONNET. It's looking at sleep influences on memory and brain aging. The idea here is that this sort of complex diagram that's over here is just sort of showing that sleep is one of those things that has such a kind of intuitive relationship to memory. We know that after a night of poor sleep, our memory and attention are not quite as good if we've had poor sleep. And so that there seems to be this relationship between one night's sleep and how you're doing the next day. But even past that, it's been noticed that chronic changes in sleep and chronic disruptions of sleep are associated with some of these protein buildups in the brain, particularly that tau protein buildup that I showed before. And we think that is because that during certain stages of sleep, there's clearance of these toxic proteins. And that if you disrupt that clearance process, it's more likely to build up. So in that way, sleep is unique in a way in that it has that relationship the night before to how you're doing the next day. So that acute relationship, but it also appears to have a chronic relationship, meaning over time with the slow buildup of these proteins in the brain. So we wanted to try to understand that, and that's the goal of this study. This sort of idea about sleep and memory and language has really been around for a long time. There's a lot of research that has talked about how during sleep, we form durable memories. So this is actually a really interesting book, Why We Sleep, by Matt Walker, who's actually part of this, the project here called SONNET. We know that there's some evidence of increased clearance of these proteins in the brain. So that's shown here with deep sleep protects against Alzheimer's disease. It's probably related to clearance and treatment of sleep apnea. And I wanted to acknowledge too right now that my motivations or the initial idea was actually generated by these two rascals down here. These are my kids, and they were cause of substantial sleep disruption. And so for a few years, when these guys weren't sleeping at night, it really got me to thinking how much sleep can impact memory and attention. So how do we do this? How do we understand changes in sleep and how they're related to these protein buildups in the brain? Well, we start off by doing detailed sleep studies. So this is what's called an EEG. This is looking at different brainwave patterns, different stages. Although we might not notice it, there's different parts to sleep. So stage 1, stage 2, stage 3, 4, and what's called REM sleep. And we can see very, very, very different patterns in those different sleep stages, and they're probably doing very different things in the brain. So we wanted to try to understand how these differences are related to the buildup of the protein tau in the brain. And this is the group of people that has gotten together to do this. I'm very fortunate to work with these folks. And these are some of the devices. So there's two main ways in which we measure sleep. One is this box over here, which sits like this, and people are tested at home. They have these leads on their head, and it allows us to see the brain waves that I'm showing here. Another way that we do it is there's a watch over here. This watch-like device doesn't have a face on it, but the idea here is that it allows us to do detailed measurements of daytime activity and also positioning during sleep. So it's just another way we can get that information. And I'm not going to go through big data presentations or anything like that, but just to give you an idea of what we're starting to see in this study is that people that have lower amounts of a particular type of sleep, slow wave sleep, these are the folks that unfortunately tend to have higher levels of tau in the brain. So we're already seeing some initial relationships, but we really need a lot more data to try to understand this and really tie this down and try to figure out what we might be able to do about it. So I'm happy to answer any questions. We'd love to have some of you join all of the studies here, including this one. And the study that I'm talking about is funded mainly by the Doris Duke Charitable Foundation and also by the NIH, or National Institute of Aging. So with that, I'll take any questions you might have, and thanks again for coming.
Thank you, Dr. Chatwell. Any questions specifically for Dr. Chatwell right now? There was one question from Randy and Ann that we will get to because it kind of applies to all of the presenters today. So I'll ask that in a little bit. But any questions, particularly for Dr. Chatwell? Oh, someone wants to know, Dr. Chatwell, how do you sign up for these tests, especially the sleeping study?
Sorry, I was muted. So there's contact information. We sort of have a central way of getting people into all these studies. So I believe Molly's on this call. So there's a central area where we get people's information, tell you about some of the studies. And if there's a particular study you're interested in, you can certainly let us know. The particular study I'm talking about with respect to sleep has a very wide range where people can come in. So there's many people in the study that have no memory concerns at all. And then we have some people with some memory concerns all the way out to people that have clinical dementia. So it's a pretty broad range. So you can contact Molly Lawrence, who's kind of the central point person for a lot of this.
And Molly was gracious enough to put her phone number into the chat box for those of you. Who don't know her number and can't get to the chat box, it's 617-726-3086. And we'll also repeat that at the end of the study. There's another question for Dr. Chatwell. Are you looking at differences with interrupted sleep as in menopause versus chronic, such as sleep apnea?
That's a really good question. So we do actually, when we set up this study, we were originally looking at people aged 60 to 90, but for the reason that you're talking about, we actually expanded it to 50 to 90. We collect some of the medical history information to try to tease those things apart. The other thing that we do is that this is a longitudinal study, meaning that we try to get repeat assessments on people and see how things change over time. So based on what people are telling us, we may be actually able to capture the exact period of time that you're talking about. But it's a really good question, and we are trying to understand it to the extent we can in this study.
All right. Save your questions because we're going to have a question and answer period afterward as well. Sometimes it's hard to come up with questions right on the spot, but I know all of our presenters are going to hang around and answer your questions as best they can. We're going to go to our last speaker, who's Dr. Patrizia Vannini, who is an assistant professor of neurology at Harvard Medical School. And she's going to be presenting her study on memory self-awareness. And so take it away, Dr. Benini.
Thank you so much, Dr. Rentz. So good afternoon, everybody. I'm going to present to you the memory awareness study, which is an NIH-funded study. And I'm going to start with this Chinese sage. To know that one knows what one knows, and to know that one doesn't know what one doesn't know, there lies true wisdom. And this sage is speaking about self-awareness and that little inner voice that you have inside of you that tells you every day to decide if you turned off your coffee maker, for example, in the morning, or if you need to turn back home and check if you did or did not. Or it tells you, for example, when you're in the grocery store, that you have missed to pick out an item in your grocery bag, even though you can't remember what that item is. So self-awareness helps to guide our decision-making and our actions. And knowing that you have a problem, remembering things, for example, helps us to come up with compensatory strategies, such as making notes, using a planner or a memory app, or seek assistance from others with certain tasks. However, that little inner voice is not always accurate, and in some instances, it might be completely wrong. And in fact, past research has suggested that self-awareness is impacted by the aging process. And we also know that this ability is impaired in individuals with Alzheimer's disease. And with this slide, which is actually very similar to the slide that Dr. Amariglio showed you earlier, I want to show you a theoretical model of the changes in awareness along the continuum of Alzheimer's disease. And I'm going to walk you through a scenario that clinicians, but also researchers often encounter when we meet participants in the clinic and in research studies. So some individuals will come to the memory clinic or enter into a research study because they're worried about their memory. That is, that little inner voice is telling them that something has changed in regard to their memory. It's not as it used to be. And when we test these individuals, most of them are going to perform within normal limits on all of our tests. And as you just heard from Dr. Amariglio, this phenomenon is often called subjective cognitive decline, or in the awareness world, we call it heightened awareness or hypernosognosia. However, as memories start to decline, we are observing different scenarios. Some individuals continue to have a clear insight and starting to have a marked concern about their cognitive difficulties. And some may not complain at all, instead claiming that there was nothing wrong with their memory to begin with. However, as the disease progresses, loss of insight, sometimes called anosognosia of memory deficits, become a very, very common and striking symptom in Alzheimer's disease. And previous research has shown that as many as 80% of individuals diagnosed with Alzheimer's disease at the dementia stage have some form of anosognosia or loss of insight. However, new findings are actually now starting to come out, and you saw some of that evidence that Dr. Amariglio showed you, that loss of awareness might start earlier than we think. And this is a slide that shows the results from a study that we did last year, looking at how awareness changes over time in individuals. We investigated individuals that were cognitively normal at baseline, but who later progressed to mild cognitive impairment, which is a prodromal stage of Alzheimer's disease. And we observed that awareness was heightened, shown here in blue. So the participants shown here in blue were complaining more about their memory as compared to the partners shown here in green. And that we were observing this approximately 1.6 or around 2 years before a diagnosis of MCI could be made. And in another group of participants who were diagnosed with mild cognitive impairment at baseline, but who later progressed to dementia, we observed that awareness was low initially, and it continued to decline and reaching anosognosia or complete loss of awareness approximately 3.2 or a little bit over 3 years before the dementia onset. So what we next are trying to set out to understand is what might be the reason for that little inner voice giving you wrong information. And to do that, we look at neuroimaging data in combination with clinical data that we have. And this is a snapshot of the findings that we have so far. And we're combining clinical data with PET images that both Dr. Chhatwal and Dr. Amariglio showed you, of looking at proteins in the brain, specifically amyloid and tau. And we have started to understand that one of the reasons for altered awareness is because of an accumulation of a protein in the brain called tau that starts to aggregate in a region of the brain called the medial temporal lobe, and specifically in a brain region that's important for memory, shown here in this figure here in blue. We have also seen that problems with insight is related to altered communication in the brain. That is, the brain regions aren't talking to each other as it used to be. And specifically a decrease in the communication between the hippocampus, that little blue area that you saw in the figure to the left, to an area in the brain called the precuneus. So why is this important? Well, we know that altered awareness may delay a person to going into their clinician or to the doctor to test their memory because they don't think that they have any memory problems. And persistent impairments in self-awareness are also linked to poor decision-making. So it may limit a person's engagement in rehabilitation activities that could potentially be beneficial. And it also imposes its own financial burden, and especially anosognosia is especially difficult for the caregiver, because the patient may not only suffer from inaccurate self-estimates of functioning, but they could also overestimate their ability to perform different tasks. So as the patient, that means that the patient might need constant supervision in order to prevent them from engaging in risky behaviors that could hurt themselves or those around them. So, however, despite the high impact that we have on anosognosia on both patients and their caregiver, our knowledge of the clinical and pathological correlates of this, as well as the prognostic value, is poorly understood. So in the awareness study, we want to learn more about how self-awareness change in normal aging, as well as in Alzheimer's disease. And we're particularly looking for participants with a diagnosis of mild Alzheimer's disease and their study partners. And the assessment that we're making is different clinical tests, actually asking people how they are perceiving their memory, and we ask the study partner the same. And we also do different brain imaging, including a technique called magnetic resonance imaging to look at just the structural structure of your brain, and PET, including amyloid and tau. And we are disclosing amyloid results, which is part of the question we might be discussing after this presentation. And same as Dr. Marshall, we also have an optional retinal scan if people are interested. The timeline for the study is it's cross-sectional, and the maximum amount of time that you need to dedicate to the study is around 6 to 8 months. We're hoping that the findings of this study may not only increase our knowledge how brain disease leads to lower self-awareness or anosognosia, with the hope that it could ultimately provide us with critical information about factors that contribute to decline in functional status and loss of independence. Thank you.
Thanks, Dr. Vannini. As you can see, there are 4 very, very interesting studies looking at different aspects of what's different about aging versus early signs of a neurodegenerative disease. There was one question, though, that came up that I want to ask all of the presenters because it applies to all of you. And this is from Randy and Ann, asking, sometimes individuals are reluctant to participate because they don't want to know their results. How is this handled in clinical trials? And how is it handled in your specific studies? Also, I would ask the corollary. What about people who want to know the results and can't get them? So can either of you address that for me, please?
Maybe I'll take a go since nobody's jumping yet. So, we disclose certain things as part of our observational studies. If we find anything that's medically relevant, that's abnormal, say we do an MRI scan, we find out that you have a tumor or a stroke that you didn't know about, we will let you know about that, and we will help facilitate finding care that you need. Obviously, we're not providing care as part of a research study, but that's an example of, say, an abnormality that we weren't expecting on a scan that is done for research, but may have some clinical relevance. So that type of information we disclose when it comes up. We generally will not disclose other information unless there is interest on the part of the participant or study partner. And some of the information we're blinded to and will not be able to disclose, period, like the tau PET scans, for example, or for some protocols, the amyloid PET scans. But as Dr. Vannini mentioned, for some protocols, for example, if people have already symptoms of Alzheimer's at the stage of MCI, mild cognitive impairment or mild dementia, we give the option to disclose the amyloid PET results. And then, there are some things, again, like the measurements of protein abnormalities in the blood that we're blinded to and will not be able to disclose, or genetic testing. On the other hand, we do a lot of cognitive testing. We do some other clinical assessments that do relate to what we do in the clinic. And that's the type of information that we can disclose if it's a validated assessment. So that's what we commonly would do in an imaging study setting or observational study setting. In a clinical trial or a drug trial, things are potentially even stricter because there's usually a sponsor that owns the data, as opposed to the studies that you've heard about now are investigator initiated. That is, we initiated them, we own the data together with the institution, but we have more control over the data. And so if it's a clinical trial, we have more restrictions about what we can disclose. But again, the big exception is usually if there's something that's medically relevant, we can definitely disclose that. And then there'll be some exceptions for things that are not necessarily medically relevant that the sponsor will allow us to disclose.
Thank you, Dr. Marshall. Anybody else want to tackle that question? There is another question in the chat. Do ADRCs share study results and materials? The answer to that question is yes. We have had people who have relocated to different parts of the country, and some of those samples or information are shared. So for the ADRCs anyway, that answer is yes. I do want to, those of you who are still thinking of other questions to ask, I do want to introduce to you our distinguished research ambassadors, Sandra and Frank Esmond. Now, they've made a decision to participate with us in clinical trials, and we would love to hear their perspective. So Sandra and Frank, can you please tell us a little bit about yourself and what motivated you to get involved?
Sure, thank you very much. And thanks for having us. I guess a little history would be helpful. Our primary care person was the first one that helped us to go to a diagnosis of Alzheimer's several years ago. And she then recommended us to a neurologist at Brigham. And that was kind of the start of our journey into research, because the neurologist at Brigham felt we could contribute to research. And since that time, which was about 4 years ago, we've been involved in 2 clinical studies and 2 observational studies. Most recently, we actually participated in the sleep study, so we were particularly interested to hear that doctor. And we've also been a part of the AWARE study. What's interesting to us is going from clinical to observational is an understanding of the difference between the two. When we signed up for sleep, I thought to myself, what difference does this make? It's not going to help anybody. So we've learned a lot by being in both clinical and observational. We were part of the CART program at Brigham. We participated in 2 clinical studies, 1 and then 3 at Mass General. And the most recent is the sleep study, which has been very fascinating to watch and participate in. The clinical ones were interesting because they involved medication. Unfortunately, it was a little bit interrupted with COVID. We couldn't go in for our meetings. We had to do it virtually, but it was very interesting. Some were pills, some were powders to drink. And most recently, the sleep study with all the equipment we needed to sleep with was very fascinating. What was our motivation? I guess for my husband, and he can speak to it better, it runs in his family. And our neurologist seemed to feel there was a genetic component to it. So we felt we wanted to contribute to future generations, our own future children, grandchildren, to see what we could do to try to solve the puzzle of Alzheimer's. Want to speak to that?
Well, there's not too much I can say. I think we've counted it out to about the 4th or 5th generation of the disease. It goes way back in the 50s. And it's very frustrating for me because I can't do anything about it. So I'm trying to work with the hospitals to as much as I can to help anybody in anything you need for other than money, I guess. I think it's an excellent progress for us. As you can tell by my voice, I'm somewhat down the road myself on this disease, and speaking is a problem. I've not been. I cannot drive my car. Had to sell that, and but you know, I don't want to sound as if it's a selfish situation, but I certainly am benefiting from knowing what's happening to me throughout this. And I'm going to pass this back to my wife.
Well, as a follow-up, one of the questions presented was, what's the value of participation? Frank's mother had Alzheimer's, and that was many years ago. In fact, she was one of the first studies of I think it was the first trial of Aricept. It was like the beginning of it, and to see if it was going to work. And obviously that's progressed. And for us, it's been an opportunity to learn about the disease and what progress is being made. And through our research, we have found that there are so many different roads that people are taking in this disease that it's really been interesting. Plus, I think we just feel we had some satisfaction knowing that we might help in this research or this progress of the disease. And
Sandra and Frank, let me just ask, did you have any fears about participating, or were there obstacles for you at all? Because I think that's part of what keeps people from wanting to join a clinical trial. What were your concerns, if you had any?
We were first introduced at Brigham, and actually we had a meeting with Dr. Marshall with our first one. And I think he explained it very well. It wasn't painful. The parking was free. The people there are wonderful. I think it's a very supportive environment, and they answered all of our questions in our first research trial. We didn't have a lot of concerns initially because our neurologist and the CART people were very supportive, and also let us know that if anywhere along the line we wanted to back out or we were nervous, that we could do that. So we felt like we had a lot of options, let's put it that way. I don't think we had any I'm going to be honest, the only obstacle we felt at MGH was getting there on the expressway. That's the only small one. And we had some concerns about whether or not we could follow the protocols that were required. But again, all along the way, we had many meetings. People explained it very well. All our questions were answered. So after we went through the first research trial, which was actually stopped, we didn't feel much worry about future ones because of our first experience. If our first experience had been difficult, maybe it would have been different, but it wasn't. Everybody at both places, MGH and Brigham, are both support people and clinicians were just wonderful. And I can't say enough about that.
That's really good to hear, you know, because we work hard at trying to make you feel like you're members of our family, and that's wonderful.
You do. In fact, Frank and I very fondly remember both you and Dr. Marshall at the breakfast thank yous, which was a nice way, first of all, to thank all of us. And it was nice for us to see the number of other people involved in research. You know, sometimes you think, how many of us are there? And we had a chance to see the number of people, talk with them, hear from you and Dr. Marshall, and it was very comforting, so reassuring, to be appreciated.
That's great. Can I just open it up to anybody on the video now to who have questions for Sandra and Frank? I know sometimes we ask our own questions, but maybe some of you have questions.
I'd like to make a comment, if I may.
Yes, Paula, please.
I'm just getting introduced to all of this, and I'm trying to join some of these studies. I was very interested in the family having Alzheimer's over various loss of words, it's right there. So I have 3 generations of Alzheimer's in my family. And and I see it coming for myself. And I just want to address this as intellectually as I can, and also hope, I don't know if there's anything that can be done, but you know, I was very interested in this couple that you were just talking about, you know, your family history. I mean, this is the path I'm taking. This is a very positive example for me to look into all of this. I've already lost my brother to Alzheimer's.
Thank you, Paula, for sharing. Sandra and Frank, do you have any comments for Paula?
Well, you know, it's funny because we know the prognosis. It's not like we necessarily have hope that anything's going to cure us. We walk into that. But the knowledge and the resources we've been given by both MGH and Brigham has more than outweighed a cure issue. We have many family resources available, social workers, and this has made the trip or voyage much easier and more pleasant. That's all I can really say. We do feel like we're part of a team.
Fabulous, because you are, you know, we can't do it without you, as Dr. Chatwell said earlier. What other comments, questions that people would like to raise? We want to make this interactive for you, so.
Can I just add one other thing?
Yeah.
One of the questions you had suggested was what would you like professionals to know about your research participation? And I think I shared some of it, the appreciation, the research. One thing that occurred to me as I'm watching this presentation is if you're looking to help people understand research, which we often, when we go to our first, what do they call screening, they explain it very well, but it might be helpful, as I've watched this today, for research people to put a, I don't know, 5-minute video together on a link that an interested person could hear about. For example, I learned more about the sleep study today that we're participating in that I didn't know about. And so I don't know how much, I don't think it would take long to just put a video together by somebody that would help the person interested to know more about the study. That's just a suggestion.
That's a great idea. And we've been trying to put little YouTube videos onto our Adrcs website about these things. But Dr. Chatwell, since there's a lot of interest in sleep, maybe you would take the lead and develop what you just did today. I do know that this is being recorded, and we could also just segment out a piece of that, of your talk, and make a video of that as well. So any comments about that?
Oh, I think it's a great idea. There's always some red tape to wade through, but I think it's a really, really good idea. And thank you so much for participating in this study. It means a lot. Thanks.
You're welcome.
I would like to say that I started out in my career as a producer, director in television, and I would be happy to participate in making films or video that people who are not medically inclined, you know, I'm not in this field. I'd be happy to help support that in the broadcast or the video aspect. I think it's a great idea that you just suggested.
Wonderful. What, you know, we can create a whole new type of ambassador, and someone who's willing to actually look at some of our materials, who has your expertise, and give us some insight as to how to do better.
Well, I'd really like to participate. I mean, I wish I could participate in finding a cure, but if I could participate in communication, talking to people who are not medical, it would be a tremendous help.
Yeah, well, I'm going to make sure that Lenore reaches out to you and that we make that contact, because we would love to have you join our team and to be a part of this effort.
Lenore suggested that I come to this.
Good. That's my girl. Well, anybody else? You know, I do have to say my husband.
I
Go
just
ahead.
have a question. We were fortunate because the neurologist at Brigham and Women's directed us to CART. I don't know how people that don't have a neurologist or aren't contacted with Brigham and Women would find out about research possibilities.
One of the ways is through the internet, and madric.org has lots of information about clinical trials, all of these observational studies, the contact information. So I would encourage you to go there and look. There's also a page about all our research ambassadors, which we call our heroes because they participate in clinical research. You can look at their stories and read about why they do it. www.madric.org is what Christine is telling us. So, and I have to say, my husband is in a clinical trial. He has Alzheimer's disease, and it's been a big help, both to our family who really want to, like you, Mr. and Mrs. Esmond, want to not pass this disease on to our next generation, that we do what we do for our grandkids and our kids. And I have to say, it's been a wonderful thing to know that you're doing something rather than doing nothing. Because when my mother-in-law had it, there was nothing to do. And all we could do is just watch her decline. So I think what all of our research investigators here today have shown is that even if you want to participate in a small way, you want to talk about your concerns, or you are concerned about your awareness and memory or your sleep, we have studies for you. And then there are these wonderful remote types of assessments that Dr. Marshall is doing that can get sent to your home. You don't even have to leave the home and find your way to the Mass General or the Brigham. That we do have some of these more remote assessments that we're looking at as well. So there is always a way to participate, is what I can say. We will find a study for you if you haven't found one yet. Any other questions? Oh yeah, Molly says many of the studies offer transportation. We will pay your way to come to us if you don't want to drive in. I know that driving in Boston can be pretty scary, but we also can get you transportation, pick you up at the door and bring you to the hospital. That we've had generous donors who have offered us money to facilitate transportation into our hospitals to do clinical trials. The other thing that we're working on that you should know about is trying to bring the research to you. So we've been trying to work with community health centers to bring research into your neighborhoods as well. There's a lot of legal issues around that we're trying to work out, but there has to be a way in which we make it easier for people to participate. Because I can tell you that the knowledge we gain from your participation has really moved the field, and we couldn't possibly make the advances we have had in Alzheimer's disease without each and every one of you.